give my permission to be videoed.
As I enter the room, I'm going to perform hand hygiene and provide for privacy. Hello, my name's Haley. I'm going to be your nurse today. Can you please tell me your name and your date of birth?
Tara Ball, 1577.
I'm going to check her 2 patient identifiers with what I have on record. And then before I begin her assessment, I'm going to take all of her vital signs and record them. And that even includes the 6th vital sign, which is pain. So today we are going to be doing a head-to-toe assessment, which is just assessment of all your components of your body from your head to your toe. We're going to start with the assessment of your skin. We're going to do this on your hands and your nails. So I'm going to assess your nails for any clubbing. There's no clubbing present on any of the nails. The capillary refills less than 3 seconds. The temperature checked with the back of my hand is warm on both sides bilaterally, not excessively cold or hot. Then the color and the pigmentation. The color is pink and pigmentation is even throughout and it's consistent with the ethnic background. And then the moisture of the hands, it's dry and not diaphoretic. Then the texture of the hands is smooth with no calluses or lesions. And then the turgor of the hands doesn't tint and it returns back to normal immediately. So that's the skin. Now we will move on to the head and the face. First we will assess the cranial nerve 5, which is the trigeminal nerve, and cranial nerve 7, which is the facial nerve. To do this, I'm going to ask you to smile, squint your eyes, and puff out your cheeks. And then I'm also going to ask you to close your eyes and tell me when you can feel something touching your face.
Now.
And all of it, that tells us that her cranial nerve 5 and 7 are both intact, and those are the cranial nerves that are for sensation of the face. And the next thing we will do is palpate your sinuses. These are your maxillary sinuses. Is there any pain or pressure here?
No.
Your frontal sinuses, any pain or pressure here?
No.
Okay, now we will assess and palpate the lymph nodes. I'm going to have her turn her head to the side, but I would normally palpate bilaterally. But I'm going to turn her head to the side so you can see what I'm doing. The preauricular in front of the ear, postauricular behind, occipital, jugulo-digastric, submental, submandibular, superficial cervical, deep cervical, posterior cervical, and then supraclavicular. Any pain or tenderness on any of those lymph nodes?
No.
Okay, so that completes the assessment of the head and the face. Now we will move on to the eyes. I'm going to assess your confrontation. I'm going to do the confrontational test first, testing cranial nerve 2. I'm going to get my blank index cards to cover our eyes. You're going to cover the opposite eye as me. Look me straight in the eye and tell me when you can see my finger wiggling in your peripheral vision.
Now.
And switch eyes.
Now.
Her peripheral vision is intact. And the optic nerve is also good because she was able to tell me now at each time we saw it at the same time. And now I will do the 6 cardinal positions of gaze, testing cranial nerve 3, which is the oculomotor that's responsible for extraocular movements of the eye, and then cranial nerve 4, which is the trochlear nerve responsible for down and inward movements of the eye, and then cranial nerve 6, which is the abducens nerve responsible for lateral movements of the eye. And to do this, I'm going to have you follow my finger with your eyes. And as you can tell, she tracked my finger with her eyes, and that means all those cranial nerves are intact and functioning properly. The next test we will do is the accommodation test. I'm going to ask you to look at something distant while I hold this in front of your face, and then focus on this. And both of her pupils constricted, which is a normal reaction as they accommodated to look at this. Now we will do the corneal light reflex. I'm just going to ask you to look straight at me. I'm going to shine this light and make sure that the light is reflecting off the corneas symmetrically in both lights, and it was. Now we will do the pupillary light reflex, which tests cranial nerves 2 and 3 again. So I'm going to darken the room and shine the light, look straight ahead, and make sure that each pupil constricts, and it did. So that's a normal response. The next thing we're going to do is test cranial nerve 2 once again with the Rosenbaum chart, test near vision. So I'm going to ask you to hold this down here and use this to cover up one of your eyes and do one eye at a time. Tell me the smallest line you can read.
937826.
20 out of 20 for the left eye. Do the other eye.
937826.
20 out of 20 for that eye as well. Now we will move on to inspecting the conjunctiva and the sclera. If I was going to touch them myself, I would put on gloves, but I'm going to ask you to pull down your eyelids. The conjunctiva are clear and the structures underneath are visible. The underneath is pink and then the sclera are white, so that's all normal. You can put them back in their normal position. Now we are going to assess the ears. I'm going to inspect the external structures. I'm going to look for any lesions, rashes, or drainage coming out of the ear on both sides. And I'm going to make sure the top of the ear is symmetrical with the nose on both sides, and it is. And then I would get an otoscope and stick it inside the ear and look at the external ear canal, and a normal finding would be to see some cerumen on both sides. And then I would also look at the tympanic membrane, and it would be normal to see that it was pearly white or pearly gray. And I would do that on both sides. And then the last test for the ears would be the whisper test, which tests cranial nerve 8, which is the acoustic nerve. So I'm going to stand 2 feet behind her. Or I'm going to have you stick your finger on your ear and move it and repeat the series of 3 letters and letters and numbers that I'm going to say.
D35.
And then I'm going to go to the other side of her.
C56.
And her acoustic nerve is good, as she was able to repeat everything that I said back to me. And that is it for the ears. We can now move on to the nose. I'm going to first check the patency of the nostrils. I'm going to occlude one nostril and have you breathe in through it while it's occluded. So both the patencies in her nostrils are both even on both sides. There's no obstructions or anything, and she can breathe normally through both sides. They're both symmetrical. And then I would get the otoscope and use the light to stick it inside the nose and inspect the mucosa. I would expect them to be pink and moist. And I would also want to inspect the nasal turbinates, and they're very tender, so I want to be very careful with those. And then can you lift your head up for me? I'm going to inspect this septum and make sure it's not deviated or any other abnormalities, and it's not deviated and there's no abnormalities. Then I would test cranial nerve 1, which is the olfactory nerve, for smell. I would get something for her to smell and have her smell it and tell me what she smells. And then I can move on to the mouth and the throat. I'm going to first inspect the lips. On appearance, the lips are dry, but they're not they're not cracking or anything, and they're not swollen. And you have any pain? Do you have any pain in your lips?
No, not currently.
So can you stick out your tongue for me now? And the tongue is pink and has papilla on it, so that's normal. And then the teeth, can you smile for me? None of them are rotten, and they're all straight. There's none that are crooked or anything, so the teeth are normal. And then I'm going to look at the gums. Can you pull your bottom lip down for me? The bottom lip, there's no lesions or anything, or ulcers. Can you pull? And the top, no lesions or ulcers. They're pink. They're both pink and normal colored. Then I would get a tongue blade and inspect the buccal mucosa and make sure that they weren't swollen or had any ulcers or lesions or anything. And then I would also use the tongue blade to inspect the oropharynx And then I'm going to get my pen light and have you open your mouth and say ah. As I inspect the tonsils, they're visible +1. And then also, as I had her say ah, that tested cranial nerves 9 and 10, which are the glossopharyngeal, which is for swallowing, and the vagus, which is for talking. And then I would also test her gag reflex using a tongue blade, and then that also tests cranial nerves 9 and 10. And then her cranial nerves 9 and 10 were good because she was able to say ah. The next thing I will do is the neck. I'm going to assess the symmetry and the range of motion against resistance. So on inspection, the neck looks symmetrical. There's no protrusions or abnormalities or anything, no deformities. Check the skin. It makes sure it's even and consistent with the arms and the hands that I checked earlier. And then for the range of motion, can you look to your left for me? And then look to your right. And then tilt your head back and tilt your head forward. And now for the resistance, just look to your left and look to your right. And her range of motion, she had full range of motion in her neck, and then she had good resistance against my hands. Then, also for the neck, I would have you shrug your shoulders to test cranial nerve 11, which is the spinal accessory nerve. And her spinal accessory nerve is good as she had good resistance against my hands. Then I would also I would palpate and auscultate the carotid artery on both sides, one at a time. So on palpation, it's palpable, it's a 2+. The other side, palpation, palpable, 2+. I'm going to auscultate for bruits using the bell of my stethoscope. There were no bruits present on either side of the carotid artery. Now I will inspect the trachea, make sure it's in the midline and it's not tender. You have any tenderness there?
No.
And then I will palpate and inspect the thyroid gland. You have any tenderness in your thyroid gland?
No.
And then the thyroid gland is not enlarged or anything, so it's normal. And then I will palpate the jugular vein. You have any pain in your jugular vein?
No.
And any pain in your jugular vein on this side?
No.
So those are all normal. And now I will move to the posterior of your chest. I'm going to have you turn around for me. And to assess her posterior chest, I'm going to look for symmetric and thoracic shape and symmetric shape. And then I will first palpate the spine. This shouldn't hurt, so let me know if you have any pain. Any pain with that?
No.
Okay, and then I'm going to percuss over your posterior lung fields. That's just striking this finger with this finger. So it shouldn't hurt. So if you have any pain, let me know. Any pain with any of those?
No.
Now I will auscultate over the posterior lung fields. Take a deep breath. And again. And again. And one more time. So her percussion was good as it was all symmetric on all 4 spots, and then her auscultation was also good as I did not hear any adventitious breath sounds. So then I will check for symmetric thoracic expansion by placing my thumbs on her lower back and watching them move apart as she takes a deep breath. So can you take a deep breath for me? And she has symmetric thoracic expansion because my thumbs moved apart symmetrically. And then I will also check for tactile firmitus by placing my hands on your back. And can you say 99 for me?
99.
And again?
99.
And tactile firmitus was also normal as the vibrations were both even and symmetric and felt both the same on both my hands. And then the last thing I will do for the back is check for costi-vertebral angle tenderness. It's just striking this hand with this hand. Let me know if you feel any pain or tenderness. Any pain or tenderness with either of those?
No.
Okay, you can turn back around for me. Now I will assess the upper extremities. First, I'm going to inspect the skin from the hands to the shoulders and make sure that it was even with the hands that I did earlier. Color and pigmentation's good, temperature's good, moisture's good. Make sure it's consistent with what I did earlier. Then I'm going to do the range of motion in the arms. I'm going to have you do a few different movements. Can you do this one for me? And this one for me? And then the circular motion with your arms. Okay, so she has full range of motion of her arms. Now I'm going to do check for muscle strength by having you hold your arms like this and don't let me pull against them. So her muscle strength in her arms is also good. Now I will palpate the epitrochlear nodes. Do you have any pain here?
No.
Any pain here?
No.
And then I will palpate the brachial pulse. That's palpable +2. Palpable +2. And then the radial pulse is palpable +2 and palpable +2. So those are all normal findings for her upper extremities. Now we will do your anterior chest, which is the front of your chest. First, I'm going to inspect and palpate it. So on inspection, I don't see any abnormalities or anything to be concerning. Any pain with any of this?
No.
Okay, and then we are going to look at your skin and make sure it's consistent with your shoulders and your arms, and it is. Doing all the same characteristics that we did earlier. Then I'm going to percuss once again of your anterior lung fields. This is the striking with my hand. This shouldn't hurt, so if it does, let me know. Any pain with any of those?
No.
Now I'm going to auscultate her anterior lung fields. You take a deep breath. And again. And again. And one more time. So her anterior lung fields sound good too, as there was no adventitious sounds there either. And next we already palpated the subclavian nodes. Now we can do the central axillary and the brachial. Can you lift your arms up for me? Any pain in your central axillary?
No.
And then any pain in your brachial?
No.
Over here?
No.
Okay, so that's the anterior chest. Now we can move on to the heart. First, we're going to do the apical rate and rhythm. For the apical rate, you assess for 30 seconds for normal breath sounds and then 1 minute for abnormal. And then her rhythm of her heart is even and normal as it should be. I didn't hear any murmurs or anything. And then I will palpate the PMI, the point of maximal impulse, which is right here, and it is a +2. It's palpable. And then I will once again auscultate the valves of the heart. This is the aortic, pulmonic, tricuspid, and the mitral. And those were all be able to hear on auscultation, and they were all normal with no bruits or murmurs or anything. Now we can have you lay back and we can do your BSE self-teaching. You will want to do your BSE around the same time each month, generally after your menstrual period. You will want to do it in the shower with the help of soap and water, or laying down on your back as you are right now. You're going to use your index, middle, and ring fingers. Go in a circular motion up and down throughout your breast on both sides. And then you will also want to use 3 different types of force. You want to use light, medium, and then firm. And note what you feel from month to month and see if you feel any abnormalities from month to month. So that completes your BSE. Now, another thing you can do is look in the mirror and first put your hands on your hips and look at the symmetry, and then move your arms forward and backward and see if they move, see if your breasts move symmetrically with each other. Now I will move on to the assessment of the abdomen. I would normally pull up her shirt so I could get a better view, but I'm not going to do that in this video. I'm going to start by listening to the vascular sounds of the aorta. That is able to be heard. Then, as I have my stethoscope out, I will also auscultate her vowel sounds in all 4 quadrants. And I heard irregular gargling in all 4 quadrants, which is normal. And then on inspection, I do not see any abnormal pulsations or anything to be alarming to me. And then I will do my light palpation. This shouldn't hurt, so if you have any pain, let me know. Any pain with any of those?
No.
Now I'm going to do deep palpation. This might be a little uncomfortable, but it still shouldn't hurt. This is to feel for your organs. Any of those hurt?
No.
Now I would have her empty her bladder before I palpated her bladder, but I'm going to go ahead and palpate your bladder since you already emptied it. Any pain on your bladder?
No.
And at this point, I would palpate her inguinal lymph nodes and palpate for the jugular vein. And you can set up now. Now I will do the lower extremities. I'm going to start by looking at the symmetry of the lower extremities, not only making sure that her legs are the same length, but also making sure that they're the same width. And I would look at the skin characteristics. That is very important on the legs, as it could tell with peripheral vascular problems. So especially the temperature, all the things that we did in the upper extremities, temperature, and you would want to also look for presence of hair on the legs and make sure that it's normal on both, even on both legs. And make sure there's no cyanosis or erythema. And then I will palpate the popliteal pulse, which is located right here behind the knee. It is palpable +2. Popliteal on both sides, palpable +2. And then you want to do the posterior tibial, which is inside the ankle right here. It's palpable +2. And then the dorsalis pedis on top of the foot, palpable +2. And then posterior tibial, palpable +2. Dorsalis pedis, palpable +2. Okay, now we can do your range of motion of your legs. We want to bring your knee up one at a time, slowly, to on top of the table.
Both.
Yeah, one at a time. And then swing your leg out as far as you can, one at a time. Test your range of motion of your hips. And both her range of motion and her muscle strength of her hips and her knees and legs are all good. So now I can do the neurological assessment. I'm going to start with the cotton. A little bit different as we did earlier. You're going to close your eyes and point to the place that you've been touched. Okay, she's good with the cotton. Now we will do dull versus sharp. This is dull. This is sharp. Same thing, but say dull or sharp.
Sharp. Sharp. Dull.
The next thing we will do is hot and cold. So the same thing, but one of these is going to be hot and one of these is going to be cold. Just tell me which one's which.
Cold. Hot. Cold.
So all of her sensations of her face, hands, arms, legs, and feet are all good, as she was able to name all of the things that I did properly. And now we will test for position sense. I'm going to be moving your hands or your fingers in different positions, and you're going to close your eyes and tell me if I'm moving it up or down.
Up. Down. Up.
Okay, so her position sense is good and intact. Now we will test for stereognosis. I'm going to be placing familiar objects in your hand. You're going to close your eyes and try to feel around and see if you can tell what it is.
A coin. Lip gloss.
Okay, those were both correct, so her stereognosis is good. Now we will test for cerebral function. I'm going to have you touch your finger to your nose and move it out, both arms. Finger to nose, cerebral function is good. Then I'm going to have you do, this exercise is heel to shin on both legs. Heel to shin is also good, so cerebral function is good. Then we can do deep tendon reflexes. So to do our deep tendon reflexes, I'm going to first test the triceps. That was +2. And then the brachial, that's +2. Then the brachioradialis, +2. Triceps, +2. Biceps, and then brachioradialis. They're all +2. Then we can do the patellar, +2, and +2. Then we will do the Achilles, which is behind the heel back here, +2 on both sides. Then we can do the plantar sole of the foot, +2, +2. So all of her deep tendon reflexes are good and intact. And that is it for the neurological assessment. Now we can do the musculoskeletal assessment. So I'm going to ask you to stand up and then bend down to your toes for me. I'm going to look at the curvature of her spine and palpate her spine, make sure there's no abnormalities in the spine now that she's bending over and the curvature is good, so you can sit back up for me. And I'm going to ask you to walk in a straight line for me. Check her gait. She has smooth and steady and even gait. Now I'm going to ask you to tandem walk for me, which is walking heel to toe like this. Then her tandem walk is also smooth and steady. And then I'm going to, the last thing on the assessment is to check the Romberg sign. So you're going to stand right here and close your eyes. So she does not sway or anything, so the Romberg sign is good. So that completes your assessment, and you can sit back up here for me. Do you have any questions about anything that we did today?
No.
Well, everything that we did today was normal. I didn't find any abnormalities or anything, so you're good to go. Thank you.